blood pressure is a way to really think about the pressure on the arteries in our body. And high blood pressure is important to control because excessive pressure on those arteries leads to stress on those arteries, which of course can then lead to cardiovascular disease, things like strokes and heart attacks and kidney disease. The problem with high blood pressure is a lot of times that it doesn't cause symptoms until the blood pressure is significantly high, so that's why it's important to be screened. But if symptoms were to occur, typically we see things like headaches. But usually you want to be screened at least once a year. If you're screened and your blood pressure is found to be high, we would probably ask you to begin to monitor it more closely with a home blood pressure monitor and begin to monitor it closely if their top number is greater than 140 or the bottom number is greater than 80. Some individuals should actually begin treatment even at lower if the top number is 130 or the bottom number is greater than 80. The biggest thing is to get screened and know your numbers. Talk to your physician about what blood pressure targets are appropriate for you. Monitoring the other risk factors and controlling the other comorbidities such as weight reduction, alcohol cessation, smoking cessation, getting regular exercise. Some individuals who recommend sodium avoidance and salt avoidance in their diet. Some experts even suggest that that can affect the blood pressure by upwards of 15 to 20 points. There are many different types of medications out there, and we can actually tailor the medications to the patient based on their comorbidities and their other potential risk factors. We can tailor medications based on the patient's gender, their race, and if they are diabetics or if they have known heart disease. So there are many different treatment approaches that we can discuss. Taking the medication just once or twice doesn't cure the underlying condition. So what we need to do is have regular monitoring of those values at home and through the office and report those readings to us. Sometimes we either have to adjust the medications or increase the medication dosage.